Toula's Tips for Caregivers. Health is on the air with Toula Wooten, your source to go for resources and information to help you in this rewarding but sometimes challenging role. Toula's Tips for Caregivers is brought to you by Age Well Institute at Baptist Health, by Elmcroft Assisted Living and Memory Care. Now here's Toula.
Well, hello everyone, and welcome again to Toula's Tips for Caregivers. As most of you know who've been listening to this radio show, I have been live and been doing podcasts of my show for about 7 years now in an effort to help caregivers, particularly caregivers of a frail elder in our nation. We know that our elderly population is the fastest growing segment of our population in the United States. Every day, 10,000 of us turn 65. We're all living a little bit longer these days, or quite a lot longer, but not necessarily always with the best quality of life. Illnesses do come our way, and my purpose for the past 7 years in helping caregivers on this show is to help connect you to resources that can help you, hopefully inspire you and encourage you to keep on keeping on in this caregiving role. I know it can be challenging. I know it can be very stressful, but I also know, both from my work and from my own personal experience as a caregiver for my parents, how rewarding it can be and the sweet joys that come from caring for someone that you love so much. So I'm very honored today to have with me Dr. Marian Grant. She is the Senior Regulatory Advisor for C-TAC. And if you didn't hear my last show, C-TAC stands for the Coalition to Transform Advanced Care. It's a wonderful organization that I got to attend their conference just a couple of weeks ago and learn a little bit more about what they are doing nationally to seriously transform and maybe even overhaul how we deliver care to those who have serious advanced illnesses in our nation. So welcome, Dr. Grant, to the show. I'm really pleased to have you.
Well, I'm very pleased to be here, Toula. Thank you so much.
Well, thank you again for taking the time, and I did learn a lot about C-TAC when I was at the National Summit a couple of weeks ago, and I'm so pleased to be a part of helping to move this effort forward. But as you know, Dr. Grant, as so many of us, 44 million plus of us, do care for someone that we love, and the role of the caregiver is starting to finally achieve more national attention, and in those awareness that is increasing, we hope we can develop more resources and raise awareness and support caregivers more. So let's talk about this a little bit, the role of the family caregiver getting more attention. How important is the family caregiver to someone who's living with an advanced illness, and what are some of the struggles they're facing?
Well, I think it's a really important topic, and I have to say, Toula, that in addition to working as a Senior Regulatory Advisor at C-TAC, I am also a palliative care nurse practitioner, and I have a 91-year-old mother who lives just a few miles away from me. So I know I know many of the aspects of family caregiving, and I would say that even though clinicians have always known how important they were, finally it's becoming recognized on a policy level. And so I can't tell you how many events there have been over just the last few months in Washington, briefings on Capitol Hill, presentations of various different kinds of research, champions like AARP, who are really trying to point out that when we think about people, especially older people and people with serious or advanced illness, we have got to think about their family members almost as much as we think about the patients, because those family members are involved in making decisions along with the patient. They're involved in providing a lot of the care for the patient. They're involved in, managing day-to-day things, medication, appointments. And if we want people's health to be better, if we want to have them to have better outcomes, we have to acknowledge and not only acknowledge the role of family caregivers, but really find a way to bring them into being part of the healthcare team and having, recognizing their role and giving them respect and making that role more official.
You are singing my song, because what I would really like, I have been a family caregiver myself for about the last 5 years, and I've worked in this caregiving field now for about 10 years, trying to help caregivers all across Northeast Florida. And as you see the struggles that caregivers have, as you see them exhaust themselves in caring for their loved ones, oftentimes backburnering their own health care, not going to their own medical appointments because they're so busy taking care of their loved one. All of that, coupled with the lack of knowledge of where to turn for help, it's time we raise awareness of caregivers and the challenges that they face to this national level. And you and I both know that the RAISE Act just got passed by Congress, and we're really excited.
Yes, ma'am.
Really excited to see that happen. Great first step.
Now, it only passed in the Senate, so now we've got to get it through the House. But obviously, getting it through one of those bodies was an amazing achievement. So yes.
Yep, it is an amazing achievement. So the next step is the House, and I have really all hopes that this is going to happen, because I do believe that we've got the right people on the Hill advocating for caregivers and talking about the issues and the struggles that they face. And like we have all said before, they are truly the backbone of our healthcare system. So our medical system, our doctors and nurses and assisted livings and clinics need to start asking the caregiver, how are you doing? As well as asking the patient how they're doing.
Absolutely. I mean, I know that, as somebody who practices palliative care, we think of the patient and the family as the unit of care. Mm-hmm. So I'm not just interested in talking to the patient and meeting the patient, but I very much want to talk as well to the family, because, or whoever the person is, that is helping to provide the support and whatever the patient needs above and beyond what they get inside, my hospital or a clinic.
Yeah, it's the family caregiver, whoever he or she may be, or friend, who is truly in the know about what's going on with that patient. And I like to tell people in the community it's time we move from person-centered care to person and family-centered care, so that physicians are asking the caregivers how they're doing. They're at risk. We have some friends in the caregiving world who call caregiving the next public health crisis in the United States. And if you think about the growing numbers and the medical risks that they're at, I can see that. I can see that happening. So I really do appreciate the work that C-TAC is doing on transforming how we deliver advanced care for those who are seriously ill, but also the focus that you have on the caregiver, because we've got to bring them in. Most times they are the decision maker. And so they need to be brought in as a care team member. So let's talk a little bit, if you will, about the research that C-TAC just did in collaboration with the Cigna Foundation. There's lots of research out there on caregiving, but what was unique about this study, and how does it highlight the needs of family caregivers that maybe some other studies may have missed?
Well, I'm glad you asked about it, Toula, because this was really an interesting experience. So, if you think about most traditional research, you put questions together, you identify who the people are you're going to ask the questions of, and then you ask them, you give them a survey, and they respond to the questions you ask. In this research, what we did was we and Cigna worked with a media organization that went out onto the internet. They went out to Facebook. They went out to Twitter. And they, instead of asking people what we wanted to ask them, they listened in to real-life conversations. So these were things that people were posting about their loved ones, in public chat rooms, on public forums. And so it was their agenda, and it was not what we wanted to know from them, but it was what they really say to each other. It was almost like listening in, eavesdropping on caregivers amongst themselves. And I have to say, although for many of us who have been family caregivers, we weren't totally surprised, it was quite alarming how frankly they spoke to each other about the burdens and the difficulties how overwhelmed they felt, how, people offered help, but you couldn't really take people up on the kind of, they didn't want more casseroles. They needed help in day-to-day stuff, and, how frustrating it was to deal with the medical system. And so these were these were conversations that were out there on the internet, and this organization, this research organization, gathered them, synthesized them, and when they're presented all together, they're quite powerful because they use the verbatim comments from the family caregivers, to totally highlight how they felt about certain key things. So it's very powerful, very upsetting to read how difficult some of these people are experiencing, their caregiving situation.
I have the results of some of that study, and I can resonate with them, because I've been a personal caregiver for my parents for the past 5 years, but also because I interact on some of those Facebook forums for caregivers. I'm a member of a couple of them, and I know, well, it helps, to hear that other people are going through some of the same challenges that you are, and then to be able to offer encouragement or maybe advice on how to find a resource to another caregiver. I mean, that's where I gain satisfaction, and in doing that, it makes me feel better. But what we found, or what you guys found in that study, which, it wasn't too surprising, I don't think, to any of us, is the really, truly, highly negative impact that caregiving can have. You called it the burden of being the caregiver. The caregiver's workload. It's not just about taking care of the loved one and what you actually physically do for them. It's what you do in dealing with the healthcare system and the insurance companies and the elder law attorneys maybe that you have to work with every day. As a full-time working caregiver myself, every day there's at least 2 or 3 things that I have to do in those realms for my mother or my father while working full-time. Yeah. So the negative impact you see, the sadness, sometimes the resentment that caregivers have. Do you want to talk about that a little bit?
I think a quarter of them, 24%, said that they failed to get adequate support from their families. And, we all see these situations, right? An elderly parent has multiple children but lives close to one of them. Now, I have 2 younger sisters, but I'm the nurse in the family, so my mom chose to live near me. And, right now I don't have a lot of responsibilities, but we are all very aware that at some point I will. And my sisters have been great about it, but they're in California. So,
not much help.
The logistics. Yeah, they mean well, and I know one of them would jump on a plane, So half of the people polled said they were unable to work, and that, they had to stop working to care for their loved one, and that was going to be a real negative impact on their income and their retirement savings. Many of them said that they just couldn't do the job they needed to do at work, and they felt badly about that, but, they were in a terrible bind, that they needed the income and the benefits of their job, but at the same time, they had to be responsive to their family members. So I don't want to paint it as too grim a picture, but what I think was important about this research is this is what they say to each other.
Right.
And so a lot of times when we come with surveys and we ask questions, I'm sure my mom was a caregiver to my dad for 9 years after he had a terrible stroke. And I'm sure if you asked her the right way, she would have said it was very meaningful. And, of course, as his wife, it was what she had, vowed that she would do, would be to care for him.
Right.
But really, amongst the chickens, you hear about, how difficult it is. So, and I think, this has been so powerful because we have taken this evidence, that we've taken these results, and we have sat down with policymakers, and we've sat down with employers and insurance companies and said, hey, this is what's really going on. And I think that's helping to really raise the awareness of the fact that, oh, my goodness, we have to do something about this. This is terrible. And we can't just let it go on and on and on. So.
Well, it's to the detriment of caregivers to let it go on and on and on without some attention being paid to them.
Yeah.
We all know that there's a large percentage of caregivers that die before the person that they're taking care of, depending upon the age, whether it's spousal caregiving or if you're caring for someone with dementia. Those percentages vary. But it is alarming when you read that 70% of spousal caregivers die before the spouse they're taking care of.
Yeah.
Because
well, and I see this in the hospital. You know, we'll discharge people, and the guy is skin and bones, can't move himself, and we send him home with his frail 88-year-old wife, and you just look at that and think that is a recipe for disaster, right? I mean, that is only going to end badly for one or the other or both of them.
And that's why more attention has to be paid to this issue, and more support given both to the patient and to the family caregiver in that situation. So I'm thankful that C-TAC is taking this and trying to drive some policy change at the national level. Do you want to talk about any of what C-TAC's doing, what some of your top legislative priorities are on Capitol Hill?
I would be happy to. So we are supporting the RAISE Act in the House. We also support a number of pieces of legislation that, although they don't specifically focus on the caregiver, they do all focus on models that would deliver care in the home to both the person, the patient, and the family. So C-TAC has developed an advanced illness model that would be appropriate for patients who are probably in the last year to 18 months of their lives. And it's delivered at home by an interdisciplinary team. So that would be doctors and nurses and social workers and physical therapists, pharmacists, whatever the person needs. But they're in the home not just to deliver care to the patient there, but also to deliver support to the family. So one of the bills that we're advocating, and actually we're very involved with writing this bill, is called the Patient Choice and Quality Care Act, PCQCA.
Okay.
And that is both a bipartisan PCQCA. It's a bipartisan bill that is both in the House and the Senate, and it includes a provision that would test a similar model that would be this kind of care in the home by an interdisciplinary team for the person and the family. We're also supporting legislation that would focus on improving advanced care planning. And, this is something where a lot of people are reluctant to think about what they would want in case they got too sick to speak for themselves. And I have to say, as a clinician, I see this putting a huge burden on families.
Oh, yeah.
And when people haven't thought it through and haven't made those decisions, then their families stand in the ICU and look at me and say, I have no idea what to do. And it makes what is already a difficult situation even harder. So a couple of the other bills that we're sponsoring and supporting very much try to improve advanced care planning, making it more accessible to people, making people more aware of this option, because that would be a benefit to the family if you could get more people to have advanced directives or at least to have discussed their wishes with their loved ones. I see the difference all the time when family members know what their loved one wants and can advocate for them. Even if they don't agree, it makes them feel like they are honoring their wishes, and it just takes the burden off of them. So that's some of the other legislative and policy things that C-TAC is working on.
That is so important. This last one, they're both important, but what you just mentioned is so very important. We all know that in our nation it's a small percentage of people who have put their wishes in writing in some kind of advanced care document. Here in Northeast Florida, where I work at Community Hospice, we are working really hard to change that, and we have implemented the Honoring Choices model here with the goal of getting 98% of Jacksonville residents and others, like they did out in Gunderson, to get people to get their living wills done. In Wisconsin. And we're working really hard on that. It's a gift. What I try to tell people, and listeners, if you're listening, if you have not done your living will, it's the best gift you can give your family members. don't leave them in the state that Dr. Grant just described, because sadly, as we all know, when family members stand around in that ICU and discuss what mom or dad or whoever may have wanted, typically they disagree. And that can cause for a lot of family arguments, dynamics, and even take it to the courtroom. I've known cases that had to be settled here in Jacksonville in the court because families disagreed so strongly. And in the meantime, their loved one's on a ventilator in a hospital while families are battling it out.
Right.
What a horrible
maybe not
thing.
where they want to be at all.
Exactly.
Yeah.
So again, listeners here in Northeast Florida, this is a nationwide broadcast. But if you have not done your Living Will, you can Google honoring choices or respecting choices and actually bring up the document, print it out, and do it, and take it to your healthcare provider, take it to whoever you appoint to be your healthcare decision maker. Should you not be able to make decisions for yourself, can't say enough about that. Such important policies that we're all working on and all advocating for to really change the way we deliver care to our seriously ill residents in the United States and help their caregivers. How can C-TAC supporters get involved in this policy-making space?
Well, I am always looking for help. So, you can certainly get involved by contacting your own member of Congress and saying how important these things are. You can go on to the C-TAC website and you can look a little bit more about the specific bills that we're advocating for. You can go to congress.gov and search for them, and you can see whether your member of Congress has been a co-sponsor. And if not, you can, it would really help us when we go to talk to people on the Hill if they said, oh, you know what, we're hearing from our constituents that this is important to them. So, I mean, that's certainly something that they can do. The other thing is that there are local efforts and state efforts, like you're talking about, you're working in Florida to try to, improve the level of advanced care planning. Honoring Choices is a state-wide initiative, and it exists in a number of states. It is based from Respecting Choices, which is actually now part of C-TAC. They joined us about a year ago. And so if you are interested in doing more, take a look at whether your state has an Honoring Choices effort. And if it does, maybe you want to volunteer to be part of that. Or if it doesn't, maybe you want to go and look and see what Honoring Choices in other states have done to see if that's something your state might do. I'm of course somebody who's in Washington. I'm very focused on the federal level, but we're not getting a lot of things done in Washington these days.
Takes a long time, doesn't it?
It takes a long time, maybe too long these days. But anyway, if they have energy for this, if you care about caregiving, go talk to your state legislators, because these are issues that have to sometimes they have to bubble up from the local level rather than come down from the federal level. So.
Couldn't agree more, and I'll be happy to say that our local state legislators are very supportive of a lot of the caregiving initiatives we've presented to them. And I was able to talk to our United States Congressman Rutherford, about the RAISE Act and send him some information.
Yes,
wonderful. And he became a co-sponsor of the RAISE Act. He had a family caregiving experience himself with his mother. That's really all it takes, is for someone to have a caregiving experience themselves, to understand firsthand the challenges that come with it. So I'm hoping we can continue to raise the level of awareness and importance in an effort to help caregivers. Listeners, that's why I'm here today talking to you on the radio. That's why Dr. Grant is here. We're here to support you and help you. And Dr. Grant, I know we need to wind up in a few minutes. Let's talk a little bit about any kind of changes that you think could be made in the Medicare program to better serve our elders who have an advanced illness.
Well, there are a number of things. So, there is an innovation center within Medicare that has tested a number of models, and we are hoping that those models will be successful enough that they could be actually nationally expanded. It's probably going to take another 2 or 3 years to get all the data in.
Right.
We know that we need to have payment models that are going to support the kind of home-based care I described. And we are working with Medicare. C-TAC actually developed such a model, and we hope to hear in March whether that model will be approved. And again, if you're interested, you can go to the C-TAC website, and there's a link to it's the P-TAC. I'm not going to get into all the alphabet soup, but the P-TAC process is how you can propose a new alternate method. The other thing we know that is important is, we're shifting to pay for value as opposed to pay for volume in healthcare. But if you pay for value, you have to have something that determines what is value. And so we're very much in need of better quality measures. Mm-hmm. And I would have to say that none of the quality measures that are being considered at the moment in any way address the family caregiver. And yet, and so that is a suggestion that C-TAC makes every time we're asked by Medicare, do you have suggestions on how to improve Medicare? Every time we say, funny you should ask. Yes, you should have measures not only for the patient, you need to find a way to measure what's going on with the family caregiver. So I don't think this is anything that's going to happen anytime soon, but these are all the things that I think we need to work for and work towards. So if anyone is interested, my contact information is on the C-TAC website. I would be more than happy to speak to anyone. I'm pretty good about checking and answering my email, so if I can be of any help, please let me know.
Well, Dr. Grant, I'm very interested in following up on some of the policies and some of the legislatives you've just mentioned. As I said, I'm a proponent of the RAISE Act, and the other two that you mentioned, I really do want to work closely with C-TAC, both at the national level, and then I'm drilling down here in Florida to make a difference as well, because you're right, it does have to start at the local level. So I know I'll be following up with all of you to see how I can make an impact. Caregivers, you can measure the impact of programs that both serve the patient and the caregiver. You can measure that impact. We're starting that here in Florida. I've started a Caregivers Coaches program for those patients coming out of one of our hospitals who is in an advanced care illness model of care that we've developed here using C-TAC's template. C-TAC was our guideline. And we're taking care of a select group of patients here that are being discharged from one of our hospital systems. And to care for the caregiver of those patients, I created and have implemented as of October 1st a Caregiver Coaches program, which I'll tell you more about next time we talk. I know you're running out of time. But we've put assessment tools in place to measure the impact on the caregiver from beginning and at the end of the caregiver coaching experience, because my goal is to keep a quality of life for the caregiver. I don't want them to just survive this process. I want them to thrive at the end of it. And I know personally how hard that is. My father just died in our community hospice program 6 weeks ago.
I'm sorry.
Well, thank you.
Oh, I'm sorry.
It's very hard. It's very, very hard. So I do it for a living, and I've done it for the past 5 years for my own parents, so I can speak professionally and personally. Caregivers have to be attended to. They have to be cared for, or some of them just won't make it. The illnesses that they are impacted with everything from depression to stroke to diabetes. I had a friend who got breast cancer after caring for both her mother and her aunt for 20 years, and there's no history of cancer in her family. It's just we have to take a look at this.
So there's no end of the work to be done, but Toula, it sounds like you're doing amazing work, and I would love to know more about it as well. So let's both stay in touch.
Well, we will connect. I appreciate all that you're doing, and I appreciate all that C-TAC is doing. We are going to make change. It may take a while, but we are going to create change for the better of our elders and others who have advanced illness and for their caregivers. So again, Dr. Grant, thank you for being a part of my radio show. Listeners who are caring for someone, I've said it 100 times. You've heard me say it before. I know personally how hard it is, but try to put yourself at the top of that list. You have got to carve out space for yourself to do the things that you enjoy, the things that you love, and please follow up on your own medical care. You know I want the very best for you. Blessings to all my listeners. Hi, this is Toula, and I'm here to talk to you about Baptist's new Age Well Institute. Are you caring for a loved one who's 65 or older? Are you a boomer like myself who's caring for a parent? And perhaps your parent has been experiencing some decline in their overall health. Let me highly recommend to you the Baptist Age Well Institute. They have the only real geriatrician here in Northeast Florida who is able to look at the whole person. Their comprehensive approach includes a nurse, a doctor, a social worker, a pharmacist, a dietitian. They have their own physical therapy there. They can work with folks with memory disorders. My goal is to help you, the caregiver, find an organization that can care for your loved one who's 65 or older. I take my own parents there, and I highly recommend the Age Well Institute at Baptist. Please give them a call at 904-202-4243. Again, that's 904-202-4243. You'll be so glad you did.
Have you read the new book, Love Stories and Timeless Tips yet? It's by our own Toula Wooten, with Toula's Tips for Caregivers. Toula is a caregiver, too, as well as an expert on caregiving. You can get it in paperback or on Kindle at Amazon.com. The book is filled with touching stories of caregivers taking care of their loved ones. Each chapter has helpful ideas that we all can use. I love that Toula included a Toula's tip with each story. Her message to caregivers is clear. Take care of yourself so that you can take care of your loved one. This is a beautiful book for all caregivers to read, whether you're a part-time, full-time, or long-distance caregiver, or someone receiving care. You should get the book today. Just go to Amazon.com. Search for Love Stories and Timeless Tips by Toula Wooten.